It's a guy named Henry Aaron, and he now works at the Brookings Institution, and he worked with Robert Reischauer, who's now at the Urban Institute. In fact, he's the president of Urban Institute. But back in 1995, together they had come up with the idea of premium support for Medicare, which is now basically being pushed by Paul Ryan, the Republican. Now, the Democrats say, hey, you know what, that would fundamentally change Medicare, so it's not Medicare as we know it today. Well, Aaron came out recently, Henry Aaron did, and said, you know what? My bad. Okay, it was a bad idea. I no longer support it. Now, look, Richard, they're more progressive, right? So it's easier for them to come out and say, oh, yeah, we didn't mean it. That's a bad Republican idea now. On the other hand, they made a pretty good point as to why they changed it, or at least Henry Aaron did, why he changed his mind. He said, I thought that if we gave people an exchange, it might work. Like, for example, but since then, we tried Medicare Advantage, which was having private companies provide the same service as Medicare. And it turns out costs went up by 8% and service didn't improve at all. So looking at the evidence, it turns out it didn't work. So which side do you fall on?
Well, totally. Look, I really respect Hank Aaron, and they do call him Hank. I really respect him for this because he did something a lot of people don't do, which is he had an idea that he became well known for. He said, you know what, based on the evidence, I got to retract my idea. It doesn't work. It's amazing you don't see that more often. I'm totally with him on this. You know, back in the 90s, it seemed to make sense that there would be competition and the different healthcare companies would come up with new and exciting and innovative ideas to make health costs better and deliver better service. It didn't happen that way. It just did because the profit motive was too great, the laziness was too great, it's too easy to play games with numbers, to cheat, to bribe a politician through a lobbyist. It's much easier to do that than it is to figure out a better way to deliver health care. So Hank Aaron's looking at the data and saying, you know what, it didn't work.
So I guess he didn't hit it out of the park. Okay, sorry.
Ba-da-boom.
Okay, all right. Now, having gotten dispensed with that joke.
He's never heard that before,
I know,
right?
Of course, right. So let's dive into the details here, because he says, look, we don't have enough regulation. So what winds up happening is that they wind up cherry picking the best customers. And so they don't share the downside, and the downside gets left to the government or whoever else is financing it. So for example, in Japan, they have really, really strict regulations on healthcare, and it works. They have much higher life expectancy than us. They score much better than us in almost all of the health insurance barometers for success, but yet they spend a fraction of what we spend, right? So he says, and that goes to your point of our guys, private companies, find a way to influence politicians so they don't get heavily regulated and they can cherry pick the best customers. Is that the essence of the problem?
Totally. I mean, look, it's certainly one of the 2 or 3 legs of the problem. They don't have to get better. They just have to bribe somebody. And I use the word bribe, even though it may be legal. Secondly, our healthcare delivery system, and Aaron says it too, we pay too much. It's not that we use too many hospital days. We use fewer hospital days. We're getting less service than the other guys, but we pay too much for it. It's not that we get more medical care from doctors. We get less, but we pay too much for it. There's a profit motive up and down the delivery side of the system too. For-profit hospitals, for-profit doctor networks, and so on. And so we're paying diagnostics, x-rays, everything. So we're paying too much. We're getting screwed. It's like we're paying $300,000 for a Hyundai and then wondering why more free market economics won't work, because it's not a free market. When I get sick, I've got to do what my doctor tells me.
To that point exactly, there's a new study out by the Commonwealth Fund saying that among developed countries, we pay not just the most, that's obvious, everybody knows that, but by far and away the most, $8,000 per person for healthcare services in 2009. The countries that came in second were Norway and Switzerland. They're at $5,000 a person. $5,000 to $8,000, okay? And that's the second highest. So we're blowing away the competition in how much we spend, but yet, again, we rank among the worst. They say the findings make clear that despite high costs, quality in the U.S. healthcare system is variable and not notably superior to the far less expensive systems in other studied countries. So, and we're getting less visits to the hospital. We have shorter hospital stays. We're just not getting a bang for the buck. The Republicans are going to scream all they want, we're number one. And by the way, in their experience, they are. Because, the Rush Limbaughs of the world, et cetera, they have all the money in the world, so they get the best healthcare experience. But for the rest of us, it's a disaster.
And Rush has got him made to buy his medications too, so it all works out for Rush. But no, look,
right.
I mean, I debated a Harvard economist on Russian TV, and I was a little intimidated. I mean, I think I know my stuff, but I figured he's got to be good. All I had to say to him was, I can point to where my model works: Western Europe, Japan. Where is your model working? When have we tried your model and had anything but failure? And by the end, he was calling me names because there's no answer to that. That's why I respect Hank Aaron, because he said, you know what? We tried it didn't work.
You're absolutely right. Of course, the top model for this way of doing healthcare is the United States, and we're ranked number 37. And that's not a very good slogan. We're number 37! Doesn't really work.
Newt Gingrich has been big on pushing all this stuff, too. So maybe that's what he'll go back to doing now that he's out of the race.
Yeah, which is sucking up a ton of money from the healthcare industry to keep bribing politicians.
Right.
That's our system. That's why it doesn't work.